ready.
Are we ready?
Roll 'em.
All right. So where's the clicker? Do we have a clicker?
Well, my husband
This
is
is
telling me to
on
bring the
number
clicker,
4.
so.
You didn't bring the
No,
clicker?
no, when I make,
On the clicker.
All right, so let's just do a brief review of Medicare, right? We know that there's a cost to Medicare. That's our Part B to us that's taken out of either our Social Security, or if we're not collecting Social Security, we have to pay it. What is it, $164.90, and it's going up to $174.80 for January. I got
That's every month.
everybody.
Oh, that's your Part B.
So we have that one. So that's the cost to us for original Medicare. We could go in cold blood if you want and not get a supplement, not get anything, and just be an original Medicare. And then in order to be compliant, we need a Part D prescription drug plan. They can run anywhere from $11.20 up to $100. So, it depends on what you want. But most people, since there's not an out-of-pocket maximum for Medicare, so it's not like our health insurance where it's, $11,000 or whatever you out of pocket, and then the plan kicks in at 100%. For original Medicare, there's no out of pocket. So that's why we try to get supplements or whatever to supplement it. So what does Medicare not cover? We'll go over that. Medicare does not cover long-term care. If you end up a skilled nursing facility, yes, you break your hip, you go into a rehab, but say you are laid up and you can't take care of yourself and you've got to have home care and all of that, it's not going to pay that. All right, so you're on the hook for long-term care if you need it and end up in a facility for any length of time.
no, right.
It does not cover dental, we know that, original Medicare, and it does not cover plastic surgery, eyeglasses, hearing aids, no.
See, they should.
But we'll get into that with the different plans, all right? So private insurance is either usually a supplement or a Medicare Advantage plan. You want to click the thing, or you want me to click it?
Nope.
The reason things go up is because Medicare reimburses the doctors.
So much.
Right, and it's done by zip codes in a way. Like New York City doctors are paid more than Middletown doctors, and they're paid more than, up by the border or whatever because of the costs of it. So that's why people pay more, perhaps, for a supplement in New York City than they do here, and the people up in Greene County pay less than we do just because of that. So inflation has hit Medicare, and they've got to keep up to keep the doctors in the plans, otherwise they drop out. They don't want to, because there's a lot of rigmarole and forms to fill out, and you have to get all pre-certifications. And also as we grow older, we just need more services.
Yeah, darn it.
Huh?
Yeah, right.
We do, arthritis. I just was reading, I looked at it. Arthritis, diabetes, strokes, they had a whole little of how many people have them as they age and the costs. So it's very costly.
I know this is off topic, but
No.
For long-term care insurance, is there, do you recommend any websites or any kind
Well,
of
actually, we
resources?
sell it in the office. There's maybe 4 carriers in the state of New York now, Mutual of Omaha and a few others. It's good to look into. It's not cheap, I'm not going to lie to you, but you can pick your plan, and it will take, like I have long-term care insurance. My husband and I both do, so that if we ended up in a nursing home, we're not going to strap the other fellow, by paying. And I don't want to become indigent and put everything into a Medicaid trust or anything like that. So it's something to look at. Some of the carriers quit writing because actuarially they didn't figure out that all the people would be using it. They thought that they might pass. So there's a few carriers they did. that, you know, Genworth doesn't write anymore. Their policies are still in effect, in other words, what they wrote, but they're not. Unum doesn't write anymore. There's a few decent ones that write, and then you just get the quote and you're underwritten according to your health.
Yeah. I've heard there's a hybrid life insurance.
There
long-term
is, but
care.
that's a percentage.
Yeah.
You know, there is. You usually can take so much of the face amount out. They'll pay you that, you know, if you go on claim. And there's also an annuity that has similar. But the real long-term care is probably more in-depth than the others. So, but Medicare does not cover long-term care, and people think that they have it, and they get into a skilled nursing facility, and after they've done their days, then they gotta pay, you know, and then it causes a lot of problems. So, before age 65, but we actually can skip this except for you have employer coverage, and since all of you are basically aging in, the seminar we did last night was for people that were just beginning to age in.
Oh,
There's,
that's it.
huh?
January,
Yes. There's a lot of, if you work for an employer that has greater than 20 people, 20 or greater, you don't have to sign up for Part B. If you work for an employer that's 20 or under, you have to sign up for Part B.
Oh, so maybe I don't have to do properly. I have to find out.
Yeah, you need to talk to
She's a retired teacher.
retired.
Yeah.
Okay. So then you need to talk to the wherever you retire, or the benefits manager, and see what's covered for you. But no, if you're retired and a retiree plan, you have to sign up for Part B.
You do?
Yes, because
Okay.
it's not considered credible coverage. Nor is Cobra. So if any of your friends start talking and saying I'm on Cobra or whatever, after 8 months it's no longer credible, and then you get a penalty and you can't sign up till January, and your plan doesn't go into effect until July. Now, Part A we all know is free to us. I'm kind of use free in quotes, and Part B we have to pay for. So yes, any retiree health insurance, anything like that when you age in, is not considered now an employer coverage, because you're not employed. So, Medicare pays first, and then your insurance pays second in the traditional Medicare. Or if you have insurance, you're on Medicare and you're working, it's the same thing. Now, in a small group like ours is at the office, my husband and I left because Medicare was first, and then MVP that we had in the office was second. And why are we paying full boat for something that, you know, we can get a supplement or whatever for much less? So it just depends on where you work. All right, everybody knows the parts, but we'll go through it. Part A and Part B came in 1965. Right. Part A is the hospital. It covers what's in the hospital, like you're operated on, you know, anything like that. And Part B is out of the hospital, so that's your doctors, your labs, that type of thing. Then Part C was enacted. That's your Medicare Advantage. We'll go through the differences. And then Part D is our prescription drug plan, which we have to have, otherwise we're fined if we don't have a prescription drug plan that's equal to or better than the Medicare one. So it has to be credible coverage. So the difference between them is you have option 1, that's what I'm on, Part A, Part B, and then I have a Medigap policy and a prescription drug plan. The benefits of that are I can go to any hospital or doctor in the United States that accepts Medicare. Then we have Medicare Advantage. In Medicare Advantage, you still have to have your Medicare, so you still have to have your A and B, but the government is paying insurance companies to manage your care. So then you have certain networks perhaps that they've negotiated with and that type of thing has to be, again, equivalent or better than original Medicare. So you have to look each year, that's kind of why we're doing it. Every year the plans change. Now they're not out yet, we don't know what they are even though we certified for them. So October 1st, they'll release information and October 15th we can start to write. But what we suggest is you look, or you can go to your broker or whoever you use, you know, and we go over all your prescriptions, over all your doctors, to make sure that the plan you're in is the correct plan, because every year doctors drop out and they go back in, and the prescription drug plans change, sometimes drastically, like the Silver Script, what, $100 and some dollars
Went
from,
from $60 to $120
Wow.
wow,
without even blinking.
without
Yeah.
blinking.
I used to have that.
Yeah, so everybody has to leave that now and go into something that's more
Else.
competitive.
Yes, and when we run prescriptions, we always look, it's hard to fathom, like people look at the cost of the premium, but it's your total cost for the year that we look at. So sometimes you may pay more in premium, but less in co-pays, and you end up paying less than if you got a cheap plan with higher drug costs, basically. So it's like the total sum.
So if you have, and you already answered this, but if I have drug coverage on my secondary, then I don't need to get Part D.
Nope, as long, you just add, just so they know that you're aware, just say, is this credible coverage for Medicare? I'm sure it is, but
Okay.
it's just good to ask them. So that's the difference. So the option 2 is a very good plan and everything. The only difference is that sometimes you can't go to certain hospitals or doctors because they're not in their network. In other words, they negotiate rates with the doctors where Medicare has a set rate. And again, it fluctuates as you go to the more expensive areas, where they negotiate and they pay a certain amount per person, driven by zip code, which is why Joe Namath always asks you, don't forget your zip code when he advertises the plans, because we're New York City, I think, is reimbursed probably much more than we are here, and then as you go up, they give you some bonuses, some nice bonuses. They give you some dental, some of them do. They help you maybe a little bit with your eyeglasses. They'll pay for like a hearing aid. Some of them will give transportation. If you're hospitalized, when you get home, they'll deliver food for 14 days? Yeah. So, they have some bonuses, so you have to look at both. But you have to usually get all of your prescriptions, your hospital, and your doctors in that plan, because if you don't, then people get miserable because their doctor doesn't participate or leaves it. So those are the differences. One is the original that our parents had, and then the other one is the Advantage, which has been around for probably 15 years, maybe somewhere in there.
And the advantage to the Advantage, the Medicare Advantage,
cheaper.
is that it's cheaper. Okay.
It's cheaper in that how can I put it? Sometimes you pay now or you pay later. It depends, with a supplement, you're gonna pay more every month, but then if you use it, if you become sick, it contains your costs depending upon the supplement. In the Advantage plan, if you're hospitalized, you're gonna have a $350 a day copay for some of them, first 5 days, first 6 days. So you gotta look at that. So you look at your health. I mean, it changes every year, right? If you know you're going in for surgery, you may wanna go with a supplement and then switch out later. And we'll discuss special enrollment periods. So.
What is there deductibles for both?
It depends on the plan. Usually the deductible in the Medicare Advantage Part C plans is in the prescription drug plan, just as it is in the prescription drug plan over there. You can get a supplement that the deductible is $226 for your Part B, and then after that you pay nothing. But you're gonna pay, what is it, about $200 here, about $220 a month. But then if you use it or go to the hospital or have hospitalizations or skilled nursing care or anything like that, you have no copays. So if you foresee hip surgery or something in the future, you know, you may always want to kind of weigh the costs. So that's the differences. Can you think of anything else to tell them? No. Okay, we'll keep going.
Or not.
Initial enrollment period is what you're gonna be in, so you're in your initial enrollment
Right.
period. You age in January, so you got what, October, November, December. So you're gonna enter your initial enrollment period the month that you turn 65, and then 3 months after. So you have a 7-month window to sign up. The earlier you sign up for it, probably the better off you are, but you need to find out about your Part B. If you're in the retiree,
Yeah.
usually, but I'm not gonna say because
Right,
you know,
right,
school is the school, so I don't wanna say anything, but I would definitely check on that to see if you have to have it under retiree coverage, because like I said, it's not considered employer coverage anymore. But ask them so that they're responsible for the answer. And who signs up for Part D during the initial enrollment? Most people do if they get a supplement. If you sign up for a Medicare Advantage plan, the majority of them come with your Part D. So everything is wrapped in one. It's just like you got all of your Medicare and it's in this Medicare Advantage plan. They do make some plans without the Part D. That's for like veterans, or people that have it through their union, because you can't have 2 Part Ds at once. If you sign up for another one, you get thrown out of the other one. So you always want to make sure that you're not, removing yourself from something that's good. Okay? You have a standalone and then the Medicare Advantage one. And you need to have credible coverage. It's called credible coverage, meaning you can't have some plan that's out in left field that's not what Medicare says it should be. But the plans they all sell are credible coverage anyway. So for this, probably we don't have to worry about this, but you can tell your friends that if they're not employed, they don't have coverage through work or whatever, they need to sign up for their Part A and B when it becomes time. A lot of people won't do it because they want to pay the money for the Part B, and then they get fined. So it's 10% per year for every year that you didn't sign up, added to the premium. And if you don't sign up for the prescription drug plan, because they'll say, oh, I don't take prescriptions, why should I sign up? It's 1% per month for every month that you didn't sign up, times a specific figure, which I believe is like $34 now. They use like a benchmark, and that's added to your prescription drug cost for the plan. So it's silly. I mean, you can get a plan for $11 for prescription drugs. Just sign up. Cheapest one, and you've satisfied their requirement, and you don't have to worry. Okay.
Now, $11 what, a month? Oh, okay.
Some of them are. But if you're in a Medicare Advantage plan, it's all tied in. But some of them just don't want to sign up at all. So that's in your initial enrollment. If you lose your prescription drug plan, somehow say you're working and you're covered under an employer, you have 63 days window, and then if you don't sign up, then you gotta wait. All right, so you don't wanna, you need to make sure that you sign up. So initial enrollment is you. Special enrollment is somebody that maybe they get into a plan and they don't want it, or it's not viable for them, or they know they're gonna have a big operation and it's not well covered, we can look for special enrollment periods. So then we could enroll you. It always starts on the first of the month. You know, so if you came in September, it would start October 1st. And they're good to have. New York has quite a few special enrollments. We've had gun, COVID, floods, hurricane, and then the governor will say, okay, this area is, you know, FEMA, and you get a SEP, and then we can take people out of plans they don't like and put, otherwise you're locked in for the year until open enrollment comes. General enrollment would apply to somebody who didn't enroll. They have to wait till January, and they don't, their insurance does not become effective till July. So, like I said, you know, if people say, oh, I'm not gonna enroll, I don't wanna do it, kind of warn them of what goes on, all right? So you can sign up. You're gonna go to Social Security, or online did you do it?
I didn't do it yet.
Okay. I would do it within the next month or so to just get it into effect, but first I would ask the human resource person, because if you go online, you can bypass B and just sign up for A.
Okay, so
Okay.
I'm just gonna ask them, are they credible for Part B?
Right, but you can ask them, do I need to sign up
Do
for
I need
Part
to
B?
sign up for Part
Right,
B?
and they should be able to
Okay.
tell you.
Okay.
So you have the original, we just discussed that, and we have the Medicare Advantage plans, and those are run by insurance companies. So we all know the ones: Aetna, United Healthcare, MVP, Humana, who else?
Cigna.
Cigna, Fidelis. You know, and they go in, like, certain companies will pull out of an area because they had too many claims. So they'll leave the area. They usually return, but it, you
This
know.
is a drug plan, you said?
Nope, this is the Medicare Advantage plan.
Oh,
If they have a tremendous amount of claims and it's not profitable to their organization, they will leave that area. They can't leave right away, they have to wait. So you have 2 ways to go, and you can switch, like I said, if you thought something was gonna happen, you know, you look for a special enrollment period mid-year, 'cause we should do they have the, open enrollment period?
Highlighted.
Yeah,
I think it's somewhere towards the end.
okay, alright, so this is just how much most people, out of pocket on health spending. Anybody track their health spending for income tax purposes or anything like that? Okay. You know, the premiums, and then the services. As we age, we have dental services, eye services, eyeglasses. I mean, when you start to add it up, it's a lot. Our medicine, even if we only take 1 or 2 prescriptions. So the total spending for 2016 was $5,460 between premiums and the cost of the insurance to us by going to the doctor, the co-pays, you know, $50 here, $20 there, $30. So, all right.
Is hearing covered under any of the
No.
hearing?
Yeah, I'll tell you what's covered. In both, the test for your hearing to see if you're deaf or not.
Medicare?
Huh?
Is Medicare or not?
Under Medicare, original Medicare in there, all right? Original Medicare does not at this point pick up hearing aids, which I think is absolutely crazy,
it
but
is, it's ridiculous.
it's ridiculous. It's
Right.
like dental. They need to do dental and hearing aids.
Yes.
And glasses, those are,
And cataract.
yes, well, they do
Glasses.
cataract.
They
Yes.
do cataract.
They do, but they don't give you the.
Oh, really?
Yeah, your cataract surgery is covered.
I didn't know that.
They
Okay.
don't give you there's a new lens from Germany, right? And you have to pay additional for that. But otherwise you can get a normal lens and you don't have to.
Oh, okay.
Okay?
Also, give me the normal.
Give me the
Okay.
normal,
Yeah.
yeah.
So,
You didn't have it yet?
So you have the monthly premiums and all of that, paid to by private insurers, but yes, you're right. Medicare does not cover certain things that really we should cover. I've said that all along.
Yeah.
But some of the Medicare Advantage plans will cover hearing aids. Now, I can't vouch for how good they are because they have their own people where they, you know, you send them. But they're better than nothing. And you can get the exam just like you can get an eye exam. In original Medicare, like I get an eye exam, I have to pay for the eye exam. It's $75 to see if I need my glasses. But the rest of my exam is taken care of, same way. Now you will get also, if you go to wherever they want you to go to in these plans, for eyeglasses, you'll get a discount or like $200 towards frames, a lot of them, you know. And if that's a concern, then we look and see who has the best eye plan or the best teeth or the best hearing aids.
But is the eye exam covered in the optician's office?
Depends. In original Medicare, no, you have to pay $75 for your eye, for the eye exam where you go into the little machine and look and they, but the rest of the exam is covered.
But if you go to, is there a difference between going to an optician versus an ophthalmologist?
No.
Okay.
People go, you know, and they have places where they'll tell you to go and then you get special deals.
Now, who does, I don't understand. Who tells you where to go?
If you're in a Medicare Advantage plan, some of them do, they
okay.
negotiate with different companies.
Okay.
What's the one in the mall?
Lens
Thanks,
crafter,
Lens Crafter,
America's Best.
America's Best. They'll say these are our preferred.
Oh, okay.
Okay, you go there, you get a better break. If you don't, then you know you may not get your $100 or whatever they would give you towards your lenses, or $200. So you have to look.
So a Medicare Advantage is different from a private.
Yes, it's still from a private. It's from a company. It's private in a way because it's, say, United Healthcare, you know, is a corporation and whatever, and they have their own Medicare Advantage plan, as does Aetna, as does Empire. So most of them are also in the medical field for small groups, employers. They cover, you know, across America. So this is familiar to them.
But it's different from Medicare Advantage.
Right, Medicare Advantage Medicare Advantage, you're actually not in original Medicare any longer.
The company
Is your Medicare.
Is your Medicare. The government pays the company to administer your
it.
care. So the insurance companies figured out a way to get in the game, basically. Whereas original Medicare, if you get the supplement for that 20%, that's more along the lines of, did you say life insurance yesterday? Like a
Yeah, it's like the supplements are not Medicare. They've been with our parents. My father, I remember.
Private.
Yeah, they're
private.
private. My dad had one. My mother had one. It picked up the costs that original Medicare doesn't, you know. And you could go to, and still can, any hospital or doctor in the United States that takes Medicare. Then, because of the fraud, we have a tremendous amount of fraud. And this I read years ago when you have to take a test every year. I think it's like $65 billion. It's amazing the amount of fraud. They felt that private insurance companies would be better at detecting, you know, like if people came in with all these claims, like sometimes especially the ones, you know, for wheelchairs and that type of thing, they'll bill. They open up, they sell, people come in, and then they're gone. Like in Florida, the state of Florida, they had one. So they felt that they would be better at detecting fraud. You know,
they?
more.
no.
No, I don't know, but once they got a foothold in, people like it because it's like everything in one. You know, I mean, you get your prescription drug plan, you get your doctors, they give you some dental, some of them do. they give you eyeglasses, they help you with your hearing aids. So there's like little bonuses, and some of them are zero, some of them will go up to $100 depending upon the plan and where you live. A lot is driven by your zip code. But we're in a pretty good zip code, but you go up farther, you know, it may be more sparse for plans. So that's what it is. So you've got 2 ways to go. You could drop out of your Medicare Advantage plan if you had one and go to a supplement. Or you can drop out of a supplement and go to a Medicare Advantage plan. You can, you know, you don't have to keep it once you have it. You can leave it. So it's not like a permanent fixture or an employer insurance.
And there are specific examples, like she has a client who had cancer and she had a Medicare Advantage plan. She was paying how much a month for chemo?
Her first chemo payment was $2,000.
Oh.
So then sent to put her in a supplement and it's pretty much all covered. But
It's
she's
all
paying
covered.
more monthly.
Monthly,
So
but
she pays $200 monthly, but she doesn't have that end bill. The services are covered.
Right, because we looked at 3 more chemos, so we started to add it up. 2,000, do that. You're better off in a supplement. Prescription
Medicare
drug.
Advantage is not built for those types of,
Yeah, you have
like
to
a
pay 20%.
woman came in yesterday, she had a knee replaced, that was perfect.
Yeah,
I
because
think if you got a hip done, you get out and you get in a supplement.
if you can, you need a
So,
So let's go into the do we have enrollment periods? This is just.
But can I just ask,
Yeah,
going,
sure.
going back one
Yeah, we can
slide,
go.
it said that there was oh
Oops.
no,
where did that end?
Let's see. It's gone, it's dissipated.
It had-
Oh, really?
it was in part A, part
Let's
B.
Like in a whole other world.
Yeah.
I do.
Tell Darren. Darren, help
Yeah.
us, help
Hello,
us.
Darren. I wanted the clicker, you
weird.
wouldn't give it to me.
Why wouldn't he give you the clicker?
Because he's my husband, I asked him 10 times and he ignored me, so.
It just said that there,
kept
it
saying,
looked like there
"Please."
was, a monthly premium for part A.
No.
If
Yeah,
you
I
don't
thought-
work 40 quarters.
You have to work 40 quarters,
10 years.
10 years,
Sorry,
and then
but-
you don't have to pay for A.
Oh, okay.
If you don't work 10 years, then you have to pay for A. All right,
Oh,
so,
okay.
and then it's kind of staggered, but some people haven't ever worked, or they were,
Right. Or life.
huh?
Yeah. Some women never life.
Well, that's another thing. Now, the government fixed that in a way, because if we were married and the man worked, we were covered, we could get our Medicare Part A for free, because we worked at home.
And what about a single person then?
A single person has to work 10 years.
And if they don't
Is that
work
it?
at all, they don't get it.
They have to pay for
Keep going.
Part A,
Right.
which is like $400 and some a month.
Right.
Well, it's the hospital.
Okay.
That's all the
Yeah,
hospital,
that's the
so.
one, but she just answered it.
Yeah.
Cause under part A,
Yeah.
she said
So-
that that
I'm
quarters.
taking gas.
Hmm?
I say I'm taking gas.
And Medicare Part B, like I said, is going up.
It went
to-
down last year, it was 170.10 in
And
2022, so it went down $5 and now it's going up 10.
And our cost,
$9 and what, 90 cents?
Yeah.
yeah, and our cost of living is minimal, so it'll take that right out of there.
Yeah.
So this is the
Oh,
co-insurance. In original Medicare, you can see the hospital, you have to pick up from days 61 to 90, $400 a day, and then from 91 to 150, it goes to $800 a day. And skilled nursing after 21 days is $200 a day. Now, in a Medicare Advantage, that's the case. If you take a supplement and you take Plan N, the $200 is picked up. So that's why I said it's
This one.
it's situational almost.
Yeah.
That's why every year go in and have it checked, you know, because if your situation is changing, it gives us time to look
into it and
at
see how
something
much-
else for you. You know, if you know you're gonna have a hip operation, you're gonna be in a skilled nursing facility,
You guys have the best
might
insurance.
behoove us to change you to the
But it
plan
would be
that
interesting to
is
know
$200 a
what-
month, but then
yeah,
you'd have no
what-
copays,
Yeah, I'm
so
gonna get something in the mail from them.
Yeah.
Don't forget it.
what they
that's
cover
how
right
it
now.
is.
Right.
Walk carefully.
Alright, so we've done that, that's part B and A, and I wanna,
Nice game.
Oh, here
That's
is
right.
Part D. This is the co-insurance for, and I made for everybody. This is, CMS puts up a model, like, you know, what the prescription drug plans have to cover each year. They kind of write what has to be covered and the maximum amounts that people can charge. Not on the premium, but like for the deductible, the co-pays, all of that. So last year, the deductible was, what was it, $545, right?
This year's
This year's
505.
$505. Next year it goes to $545. So in the deductible phase, that's where usually we pay for prescriptions. We have a copay for 1 and 2, you know, and then 3 and 4 costs us more. The initial coverage, then after we leave the deductible, might be $250. So if you get a prescription for something like, I don't know, Lipitor or whatever, and it's a tier 1 or 2, you're just gonna pay a copay. If you come in with Eliquis for your heart and you have that deductible, you're gonna pay good money until you meet this level, and then you go to the next phase. And the next phase is it's like the initial phase, the coverage, the deductible limit, then the initial, and that one is it changed to $5,030. So you can stay in that until you and the plan have out-of-pocketed like $5,030, and then you go to the next phase. Most people don't ever go into the next phase unless you have very high costs, and that's the out-of-pocket threshold, and that's $7,400 this year, and it goes to $8,000 next year.
I'm not going in the first phase.
So, but have we ever had anybody go?
You're not taking that aspirin?
We have
or
3
whatever?
now that are in the donut hole.
Okay.
Mhm.
The
But they're
prescription.
not gonna make it out.
No, the prescriptions that you see advertised on TV, many of them,
No
you know,
Yeah.
they're the
Yeah.
ones that
Yeah.
cost a lot of money, and they advertise them, and then people
Do you
go.
know that America is the only country that advertises drugs on television?
I know.
Absolutely.
I'm not surprised.
And you know,
that
people
goes to show you who's in charge.
people
Yeah.
vote
Yeah.
against their own interests
That's right.
Yeah.
when it comes to healthcare.
Yeah.
They do. I
They do.
remember they go.
They do. And then they're angry, and it's kind of like, well, you got to listen to what those dudes are saying there, right?
Yeah.
I mean, we pay with our tax dollar. That's what I think about, right?
Yeah.
To a degree
Yeah.
for the research, but they'll say it's for innovation or
And
whatever.
how much do they spend on advertising?
Oh, a
Yeah.
tremendous
Yeah,
amount of
millions.
money.
Well, last year, a year ago, they passed the Inflation Reduction Act last September, October.
Yeah, right.
Would you give a
Which-
discount?
Well, what's supposed to happen in 2005, Bush made it so that Medicare, Big Pharma did not have to negotiate with Medicare, which is why we have these prices. So one of the things in that act last year was that the big pharmaceuticals have to now negotiate with Medicare. The big pharmaceuticals have responded by suing the government. So that's their response.
I
So,
didn't know that.
yeah. And that's how they get us, because,
It's
you know,
ridiculous.
yeah.
Absolutely ridiculous.
But in New York State, we do have Epic. Everybody familiar with Epic?
I'm not.
Okay.
I just moved back.
Okay, Epic is a state pharmaceutical assistance program. If you're under $100,000, you can sign up, okay? We use Epic, we try to sign everybody up that is eligible for Epic because it gives us a special enrollment period. You have a special enrollment, so we'll sign people up, fax it up, say emergency, but we'd rather sign you all up, you know, as you come in, and it's just a little form, we fax it up.
I got one card in the mail from them.
Yeah.
I don't know why I got it.
Get
Because
it,
we signed you
keep
up.
it, cause
I
you'll be
did
signed,
keep it, and
yeah,
I
we
show
signed you up.
When I go for a prescription, I show every card that I
Good
have.
for you.
RX and
Yeah.
like Aetna and
You're our best student.
Yeah.
I had a star, I'd give it to you right now.
I said, take the one that costs the less.
Yes.
That's right. And so what they do is then they help with the cost of your prescriptions. And when you meet a certain deductible, if you're not eligible for immediate, you know, then they will pay. And then if somebody's really poor, they'll pay like $5, $0, $20, the maximum. I mean, I've seen people really having struggle with, like, say, Eliquis. They're not gonna get it
Ooh.
because it's so expensive, so then we could put them in Epic and, try to help them that way. But it also gives us a special enrollment period, which is nice. So remember that. This is just original Medicare. I got my shots today. I didn't have to pay for my flu shot and my RSV shot. They don't have the COVID.
Yeah.
They ran out.
I got
My
COVID.
husband
Yeah, they
just
ran-
got it today.
You did because
But not me, my husband. This
okay, I
morning.
went to
Oh, yesterday
Walgreens.
morning.
I went to Walgreens. I had,
Yeah.
she said, "I'm so sorry. We just ran out of COVID, but I can give you the RSV and the flu." I said, "Give me whatever you got." And
Yeah,
they're
I
free.
went last week and
Yeah.
got- yeah, both.
So we can skip that one. This is what Medicare does not cover currently. Acupuncture, some of them do. Some of the little plans, the Medicare Advantage, not that they cover acupuncture, but they'll cover chiropractic.
That's good.
But they don't cover currently, but maybe this year they will. They don't let us know until they release it. Massage. I have a lot of people wanting massage,
Yeah.
for,
Backache.
yes, or arthritis. And why not, if it helps them? And no dental, unless say you were in a car accident and your teeth needed to be, but not just to go in and say, I have a decay, I need a filling. Doesn't work that way. So these are the things that Medicare does not cover. Also, if you travel, they will say out of the country, but I always advise people if they're gonna travel extensively and go, to another country, to buy
Insurance.
the travel insurance. You don't have to get, you can get whatever you want, but they do have like evacuation, and that's what I always get if we're going to some place where I'd wanna be evacuated.
Oh my goodness.
No, we had a woman, she got stuck in Italy with COVID.
Yeah.
And then, like, if you get released, you don't have a plane ticket. So that allows you then, your plane ticket's gonna be $3,000 if you're in a faraway place. So it covers that.
Were they flying though?
Mm-hmm.
Well, she was COVID free.
Yeah.
They said she was better.
She was
Yeah,
better,
she
yeah.
had to stay in a hotel for 7 days. She said it was awful. There were 3 or 4 of them,
Yeah,
right?
yeah,
She
bunch.
didn't even know she had COVID. They test everybody before they get on the plane. And like
She
4 of
just-
them tested
Oh,
positive. She
wow.
said it was terrible. And every time she stuck her head out, the lady yelled, "Get back in your room!"
Oh, no. Wow.
Oh dear.
Oh,
dear.
All right, this was just what we kind of went over with the prescription drugs and the deductibles. Some drugs are not covered; they just don't cover them. You can get if you absolutely need it. You have to go and kind of wangle your way in, and you can do that to a degree. It's not like it's
What is it called, what the doctor gives if you,
Oh, he gives a what is it called? An exception.
an exception?
I have to think of what their terms are.
Yeah.
He'll get an exception. Say it's not on their formulary. They all have formularies because they're all negotiating this way and that way with this company and that company. If it's not on their formulary, then the doctor can write that this is an absolute needed prescription, and the company will then honor it, but usually it's in one of the higher tiers. It's not, so you have to be aware of that too.
I didn't even think of that.
And some plans don't have deductibles.
Sorry.
That's all right. No, just on prescriptions. But the maximum one is $545 for this year.
For next year.
For next year.
Yeah, this year's 505.
Yeah, it's up $40. And once you and that's usually on tiers 3, 4, and 5. And Medigap policies, again, like United Healthcare, Globe, Empire, all of them have, and they're across the country. Different states have different, vendors or whatever you want to call them. Not all the companies sell in every state. Some sell in some, but not others. But United Healthcare seems to be pretty much across the board, and a few other ones. And it's standardized. This is a hard concept. But when you buy a Medicare policy here or Pennsylvania or whatever, they come in letters like A, B, C, F, G, N, M, L, K, right? They're standardized. Meaning you can buy a policy here, the N say, that's what I have, the N plan. If I go to Pennsylvania and buy an N plan, I'm gonna have exactly the same, things that it covers. It doesn't vary. The only states I can think of is Florida has kind of a variation in a couple of them. And New York State does not underwrite, meaning you can get it even if you were very, very sick. You can, especially if you're aging in, you can join right then. There's no pre-existing conditions or anything like that. New Jersey underwrites after 6 months.
Now this is private insurance.
This is private. This is like what our parents had. The supplement, your mom and dad went and maybe, or whatever, and they paid the doctor $5, but it covered expenses that for the like $120, say if there was a deductible, or depending upon the plan that you picked. So it's like tailored. You can pick a tailored way you want to go. All right. And then Medicare, we went over Advantage plans. They do have networks. Some hospitals don't participate. Most of the hospitals do. Some of the times the hospitals participate and the doctors don't participate. See, when you want to go to a hospital and a doctor, we always check to see the hospitals there and the doctors in the plan.
Now is this who is constantly